Well, I think that there is a consensus that early delivery of calories can be dangerous before the stabilization of the patient, so that we should avoid the risk of overfeeding or autophagy or even refeeding syndrome during the acute phase, at least in terms of caloric intake. Well, I think it's very important that people recognize the risks of excess nutrition during the early phase and insufficient nutrition during the late phase and before the discharge of the patient from the ICU. So the follow-up of nutrition should not stop when the patient are discharged from the ICU. That's the first achievement I would dream to reach. And the second one is that we need to measure what we are doing, and this is not the case in most ICUs worldwide. Well, I think that we should facilitate or increase the use of indirect calorimeters, or at least of capnometry, to get a rough idea of the energy expended, and to incorporate that into our routines, probably via computer-assisted systems. We also need to work on the collection of long-term outcomes, which is difficult, which is also influenced by the post-ICU care, but that's definitely something that's needed. If we can improve the patients via an adequate nutrition, would be on long-term functional outcomes. While if we do wrong, if we use unsafe procedures, we will see it on early parameters such as rate of infection or even mortality. That would be a signal of harm, but the benefits are expected on a long-term scale.